Ferinject is indicated for treatment of iron deficiency when oral iron preparations are ineffective or cannot be used. This segment shows how to properly administer Ferinject as an intravenous infusion. Ferinject as an IV infusion. First, prepare an IV bag with a sterile 0.9% saline solution. Note the maximum dilution. Other diluents and the simultaneous administration of other medications are prohibited. Attach the IV line properly to the IV bag. To administer Ferinject, select one of the suitable instruments. An intravenous cannula is recommended for the infusion. Apply a tourniquet and look for a suitable vein. Insert the cannula and secure it. Once the vein has been punctured, inject approximately 10 milliliters of a saline solution to ensure that the cannula is correctly and comfortably inserted in the vein. Now, attach the IV pouch. Ferinject is then drawn up from the vial and added to the saline solution. To draw up 100 milligrams iron from the small vial, you may use, for instance, a 2 milliliter syringe. To draw up 1,000 milligrams or 500 milligrams iron from the large vial, you may use, for instance, a 20 milliliter or a 10 milliliter syringe, respectively. A pink injection needle is suitable for either type of vial. Other standard instruments for intravenous administration may be used depending on the patient and the situation. Now uncap the vial. Insert the needle into the vial and make sure that you draw up the Ferinject solution slowly. It is not possible to draw up the entire content of the vial into the syringe. A small residual amount of Ferinject will remain in every vial. This amount is normal and is accounted for in the filling process. For sterility reasons, Ferinject must always be used immediately. Therefore, you should dispose of all open vials, even if they are not empty. Now inject Ferinject into the free opening of the IV bag with a new needle. For a dosage of 500 to 1,000 milligrams iron, a minimum infusion time of 15 minutes is required. Note the minimum infusion time required. Note the dilution plan for intravenous drip infusion. Caution should be exercised to avoid paravenous leakage when administering Ferinject. Paravenous leakage of Ferinject at the injection site may lead to brown discoloration and irritation of the skin. In case of paravenous leakage, the administration of Ferinject must be stopped immediately. As with all IV iron products, each patient should be observed for adverse effects for at least 30 minutes after the IV iron administration. Ferinject offers an easy determination of the patient's cumulative iron need based on hemoglobin value and body weight. Up to 1,000 milligrams iron can be administered in one single IV injection or infusion. No test dose is required.